Hi everyone, I'm Michael Uriarty or Dr. Mike, and welcome to the MYK System channel. This is episode 4 in our series comparing and contrasting other techniques with the MYK system. Today, we're going to talk about applied kinesiology. We'll give a brief history and description of what I could find about this technique, and then we'll cover the similarities and the differences to the MYK system. If you want more information on either technique, I have the website links in the description below. Whether you're a patient looking to get help or a practitioner looking for a good technique to learn, this series is what you need. Let's dive in. How did applied kinesiology start? Applied kinesiology, or AK, was founded by George Goodhart. George was born around 1919. His dad was a chiropractor. His name was also George. And he graduated from the D.D. Palmer Alva Gregory Chiropractic School in Oklahoma. Now, George went and graduated from National College of Chiropractic in 1939. We learned in episode 3 that in 1939, that's when that German guy, that guy, he invaded Poland, and that started World War II. So very soon after he graduated, he went off into the Air Force and fought the Heisenfreichen guy. When he came back, he went to work for his dad, or with his dad. And I think it's important to look at the school that his dad went to in Oklahoma. Alvin Gregory was a medical doctor and a chiropractor, and he had graduated from, of course, the Palmer School of Chiropractic. He wanted to medicalize chiropractic. I don't even know if that's a word. I think I may have just made it up. But medicalize, he wanted to bring the chiropractic adjustment into general medical procedures. So instead of an adjustment, he called it spinotherapy. So, no, not spino, spondylotherapy. So spondylotherapy manually moved the bones of the spine. It used traction, massage, therapeutic heat, all of which were anathema to B.J. Palmer. Yep, I'm with you. I had to look up that word. Anathema. It means something or someone that one vehemently dislikes. So I think it's fair to say that this guy never got a Christmas present from the Palmers. I think it's important to know that George's dad went to this school and was trained to do more than just adjust the spine. And this probably gave George the ability to think outside the box and come up with AK. Both George and his dad studied under Major Desjarnette, who developed SOT, which was episode 2 in our series. I watched a video of Dr. Goodhart telling a story of how AK started. He said in 1964, a guy came into his office with a shoulder problem. And the guy was in the waiting room, and he said real loud, "Hey, when are you going to fix my shoulder?" Well, Goodhart had been working with the guy's ankle, and the ankle was a lot better. And so George was like, "Right now, get in here." And he was like, "Geez, shut up." And that was pretty close to how his story went in the video. So the guy mentioned that his scapula, or his shoulder blade, would pop out from time to time. And George checked him out, and he found that he had a weak serratus anterior muscle on the right side, and it had some nodules in it, had some bumps in it. So he started pushing on those nodules and moving around, and he said it started to fade away under his fingertips. And the guy felt better almost instantly. George said that someone had given him the Kendall muscle testing book. I have the Kendall muscle testing book. And he thought it was interesting, but he didn't see a reason why you should just muscle test and find a weak muscle. After this guy with the shoulder problem came in, he started seeing why someone's head was off, or why their shoulder was high, or why their hips were rotated, and he started seeing the weak muscles in their bodies. So what is the theory and philosophy of AK? According to the International College of Applied Kinesiology, AK is a diagnostic system using muscle testing as a tool for evaluating neurological function. The method focuses primarily on neuromuscular function as it relates to structure, chemical, and regulatory mechanisms. Muscle testing assesses the impact of the nervous system on a person's health so the provider can look for the source of disease in the balance of the sensory system with the motor system. So it's mainly a diagnostic tool. It's more diagnostic than a treatment. It goes on to say that AK uses functional assessment measures such as posture and gait analysis, manual muscle testing as a functional neurologic evaluation, range of motion, static palpation, and motion analysis. The provider is supposed to use this information in conjunction with a history, physical exam, lab work, and any other tests. He found that postural distortions or unbalanced postures led to muscles that would test weak. I'm going to agree with that, of course, because that's what we look at all the time. So he and others found that there were many different conservative treatments that improve neuromuscular function as seen through an improvement in the muscle test. So basically, you look at a person and you go, okay, this is off, let's muscle test. Oh, that's weak. And then they would do some sort of treatment, and then they would go, okay, let's muscle test again. And what you should get, if you cleared it, is a strong muscle test with that. You'll see a difference. So a pre and a post basically muscle test. Some of the treatments that they'll do joint manipulation or mobilization, myofascial work, cranial techniques, meridian therapy like acupuncture stuff, or same thought process, I think without the needles, nutrition, and various reflex procedures. So what does the practitioner do? The big thing is going to be the manual muscle test. They say they use the use of muscle testing is an ideal neurological feedback tool. In the common terminology, people like to say that a muscle is either strong or weak, but this doesn't refer to the person's overall strength. This is just an indication that the muscle being tested is either performing the way it should or is not performing the way it should. Testing isn't as simple as seeing how strong a muscle is. So here's a couple things: that position, force applied, different body position changes, isolation of the muscle, and the timing are all used to accurately assess muscle function. Muscles can have an imbalance due to an injury or a physical neurological issue, chemical and biochemical issues, even emotional and electromagnetic type issues. So I had no idea that it tested for all those things. The practitioner will use whatever tools they have in their bag, whatever technique or treatment they think will work best for the patient. Now, I found a list of muscles, according to AK, that if these particular muscles are weak, they would say there's a problem in this particular organ. I'm definitely not going to go through all the muscles, but here's just a few. So if we do a few in the upper body and a few in the lower body. So the subscapularis, if it tests weak, it means that there's something going on with the heart. The coracobrachialis, levator scapula, deltoid, and serratus anterior, if any of those test weak, it would be something going on with the lungs. The rhomboids and the pec major on the sternal side would be a problem in the liver. The pec major on the clavicle side, the neck, the SCM muscle, the biceps, the brachioradialis, and the pec minor, any of those would say, oh, you got a stomach problem. In the lower body, the popliteus muscle says it's a gallbladder issue. The psoas and iliacus say that it's a kidney problem. The quads say it's the small intestine. The hamstrings and the TFL say it's the large intestine. So my thought process, I'm like, okay, how did you figure this out, right? How do you relate these particular muscles to those particular organs? You know, what are you doing? Because I've been dealing with muscles for like 30 years. So how'd you come up with it? So I found a paper on the Logan Chiropractic University website. And basically, I think what I Googled was, how did AK find the organ to muscle connection? That was something like that is what I Googled. And in this paper, it said, the earliest signs of organ muscle relationships recorded were in drawings of yoga exercises in India. The positions applied pressure to or stretched specific muscles to each organ problem. So a comparison shows the muscles being affected by the exercises to be similar to the ones related to the same organ that Goodhart introduced in the 1960s. So maybe George got his information from this, and I think that would be pretty cool if he got his information from something, that dates back, 4,000 or 5,000 years ago. I mean, that would be pretty cool. So, but I don't know where he got his information, but that would make sense since there's so much correlation between those two. To me, that kind of makes sense. What does AK treat? Why would someone go get applied kinesiology? On the International College of Applied Kinesiology website, they provide a huge list of conditions that AK treats. So I'll put in the link below, I'll put the link to that, and you can just click it and it'll take you right to that page, and it just keeps going down. It's a lot. So I'll just name a few. A few of the lower body issues that they say: Achilles tendonitis, ankle sprains, low back pain, sciatica, shin splints. A few upper body problems, they say neck pain, rotator cuff issues, shoulder pain, TMJ. And then some other common conditions like allergies, GERD, headaches, things like that. I'm just listing a few. Go check out the link if you want to see more. What professions do they teach? Does AK teach? They teach quite a few. So they teach the medical doctors, dentists, chiropractors, osteopaths, and I'm sure there's more. Those are the main ones that they listed out. What's the cost of the class? There seemed to be a lot of different instructors for the AK classes, and the prices were all over the place. Most of the classes were 100-hour certifications. I saw that you could take the first 3 classes, and this is the basic, and then the next 6 classes or 7 classes, and this will get you into the certification. And so just those 6 or 7 were I saw it as low as $1,200, but I also saw it $2,600. So it really did depend on who was teaching the class. Now, I went to the International College of Applied Kinesiology websites, both for the United States and Canada, and neither one of them were updated. They showed classes being held in 2019 and 2020, and just, from my standpoint, that's just not good for business to not have an updated website. So, fellas, got to go work on that. What are the similarities and differences between AK and the MYK system? The first big difference is that AK is more of a diagnostic system, and the MYK system is pretty complete from assessment, treatment, and rehab. So we can kind of do all of that. The second difference, and I'm not going to say that AK doesn't treat, but they don't necessarily have a specific technique. So they use a whole bunch of different techniques. And maybe you get those different techniques in with their certification program, but I don't think you do. But again, I could be wrong. If you know, put it in the comments below. Let me know. The second difference is how we assess. So applied kinesiology uses muscle testing to figure out what's going on. And with the MYK system, we use a posture chart. It's like a checklist, and you just go off the postures, check, and you can narrow that down to one nerve level. The third difference is the treatment itself. So AK uses many different things. They'll adjust, they'll do myofascial work, cranial treatments, meridian therapy like acupuncture, but I think instead of using the needles, it's more like acupressure points. And he mentioned Chapman and Bennett reflexes. So I'm going to go look that up and see what that entails as well. That may be a whole nother technique that I do a video on. The MYK system is solely a soft tissue treatment. So we treat all the muscles along one nerve pathway on both sides of the body to clear that pathway. And in doing that, we not only clear that pathway, but when the person stands up, all that information goes up to the brain, and the brain goes, okay, with these changes, now these other muscles have to contract or relax based off that, and that's where we get a balancing of the posture, which then gives you an increase in range of motion and a decrease in pain. So, a similarity is in the conditions that we treat. Both of us say that we help the normal things like carpal tunnel, plantar fasciitis, headaches, things like that. And we both say that we can help with different organ issues, so acid reflux, incontinence, and different things like that. A fourth difference is in the professions that we teach. So AK teaches medical doctors, osteopaths, dentists, and chiropractors. The MYK system, we teach physical therapists and PTAs, occupational therapists and OTAs, athletic trainers, massage therapists, chiropractors, nurses, personal trainers, and there's some others that if they would want to get their hours, I'm sure they could. Those are the main ones. The cost of the classes were very different also. Like I said earlier, the cost of AK were kind of all over the board. They do have a 100-hour certification. The MYK system has an 80-hour certification, but you don't have to get certified with MYK. I think with AK, you're supposed to go through the process. Again, I could be wrong. Maybe you can take just a weekend class, but it didn't appear that way. But with the MYK system, you can get 20 CEUs and just take the upper or the lower class. Personally, I really enjoyed watching some of the videos of Dr. Goodhart telling his stories and how this came about and the people that he treated. I think it would be cool to go in and get muscle tested and see what issues they say would be going on with me, and then, see if we could get them fixed. So I think it would be interesting to get this done. Be sure to hit the subscribe button. I have more videos coming. If you made it this far, smile.